to the best of our knowledge. What we can say is that we've done all we can, not only to ensure the safety of the firefighters that are on duty, but also to ensure the safety of the citizens and the community we respond to. How does this impact staffing? Graciously, again, through opportunity of the state fire marshal and neighboring departments, our continuity of operations has not ceased. We have delivered and we will continue to deliver the utmost and thorough response in order to serve the citizens of this community. Dealing with how the community can assist. The community can assist, and again, I will defer this to Health and Human Services, but the community can assist by continuing to uplift prayers and continue their well wishes, not only to our firefighters, but all responders and all individuals that are actually affected by this horrendous situation. At this time, I'd like to move forward with introducing the state fire marshal.
Thank you, Chief Bruton. On behalf of Insurance Commissioner and State Fire Marshal, our thoughts and prayers are with the firefighters of Albemarle and their families and what they're dealing with at this time. Our role here in Albemarle, as is statewide, is that we're responsible as the regulatory agency for the fire service of North Carolina. In times of emergencies, we are responsible for the fire protection for the state of North Carolina. With that said, we are here with the IMT team, incident management team, and working under the State Emergency Operation Plan for State Mutual Aid. And we have reached out to outside resources, which of course is Kannapolis and Concord, that has been gracious to fill those slots through Monday morning at 0800 hours. And this is not new to us. Since the pandemic, we have went into other fire departments across the state. The most notable is Clayton and Johnson County, and we have worked closely with them. So the experiences we bring from around the state, we have come here and assisted Albemarle with that transition and during this situation they're facing today. Thank you.
So what we'll do now is open it up to questions. We have, as I said, information here at the table. You've heard the comments. I think most of what has been said or what is able to share down here is going to cover what we know and are able to say and relay. But what we plan to do now is take one question from each media outlet and try to answer those the best we can. So we'll start from left to right. If you have any questions that have not been addressed or follow-ups that we can answer.
Can you reiterate again and apologize for
Sure. We've had a COVID outbreak in the fire department. We've had a COVID outbreak in the fire department, as I'm sure you're aware. We're trying to take care of our coworkers, friends in the department to make sure they make a full recovery and do what we can to support them. We also have support from surrounding communities to keep services going. So at this time, all Albemarle Fire Department staff are receiving a break for their mental, physical, and emotional well-being until the shift begins at Monday at 8 o'clock. We're receiving right now the assistance of the Kannapolis Fire Department and the Concord Fire Department. So,
Hi, so I think you mentioned that 10 firefighters at this point have tested positive. What are you doing to ensure that others don't test positive? Is there any kind of efforts to maybe work on vaccination for the department?
sure, I'm going to let Chief Bruton answer that question.
Thank you for your question. What we have instituted, first of all, is, again, the opportunity to take a break, rest, relax, rejuvenate. This is very important for any healing process. The next step, and probably one of the most critical, is pre-screening. Before anyone comes into the station, before anyone starts a daily shift, At that point, we will conduct baseline testing, and that is temperature check and asking pertinent questions. We are also sanitizing stations every morning. Not only sanitizing the stations, but the apparatus that the firefighters actually use to respond to emergency critical care calls.
So are all of the firefighters taking a break? No one is coming to work right now?
All shift personnel, except for the battalion chiefs, are on what we call critical care break. Thank you.
Chris?
For those firefighters that were not hospitalized, I mean, I don't know if you can talk about this, but do they have any mild symptoms, or is there anything you can discuss just about kind of their conditions, the ones that didn't go to the hospital?
What I can tell you is that once we were notified, at that point we followed all local, state, and federal guidelines to identify, isolate, and at that point move to next level. And that was taking care of not only those who have had symptoms, those who were asymptomatic, and those who were exposed, or were possibly exposed.
Dave?
Social media reports maybe a firefighter on a ventilator, maybe one with pneumonia. Can you confirm or any of that for us?
What I can confirm is that we have 3 firefighters that are receiving the best possible care in our hospital system at this moment.
Can you talk about whether or not these firefighters vaccinated? Kind of, have you guys had vaccine outbreak at the station yourselves? And I guess too, if they were with the Delta variant, just kind of expand upon that for us.
What I can tell you is that the city of Albemarle does not have a vaccine or vaccination policy. What we do is actually follow the guidance that is given locally, state, and federal.
So were the firefighters vaccinated at all, the ones that got sick?
At that point, again, all I can tell you is that we follow guidelines.
That's their personal private health information, and so we don't have access to that, and that's not something we have an answer for or would know.
Do you know if it's with the Delta variant at all?
Don't know that kind of information as well.
Hey there, how are you? It's nice to meet you. I'm Penny Terry with Channel 9. I had a couple of questions, and just bear with me because a little information was left out of what was said earlier. So you all said that at this point, all of your firefighters are on a break. How long has that break been going on, and how many individuals are on that break? Because I don't know what your staff is like.
Excellent question. The answer to that is shift personnel. So suppression personnel consists of 39 individuals. Of the 39 individuals, we have 3, A shift, B shift, and C shift, that are covered by and staffed by either a battalion chief or a captain. So immediate personnel supervisors are covering the shifts. At this point, the remaining shift personnel are actually on break. And as the city manager spoke to earlier, normal operations will resume at 0800 hours Monday.
And then have there been any vaccination or testing requirements as a result of this incident? I know you said when the individuals come back, they will be screened before coming back to work, but are there any changes that have specifically been implemented pertaining to vaccination or testing as a result of this incident?
As again, the city manager spoke earlier, personal information, we don't venture on that. What we do is follow guidelines. And with that being said, I spoke earlier on mandatory temperature checks and mandatory questions that will identify and move forward from there. Thank you.
There's no requirement for vaccination, right?
What I will say,
Okay, just making sure. I understand. Can I ask a fire marshal question real quick?
Sure.
Please. Sir, thank you so much for being here. Can you talk a little bit more about other departments across the state who have experienced something similar to this outbreak? Is this the largest one you've heard of?
Well, the demographics of the fire service, over 1,200 fire departments, 1,300 fire districts across the state, they're all sizes, from volunteer 100% the combination to career departments. Charlotte which is everybody's aware, Charlotte, and the largest fire department in the state, has managed and dealt with the COVID outbreak and has had over 150 firefighters out at one time and covering those shifts. What you see in what I'll say more rural or suburban, outside of suburban areas, they're smaller and logistically they can't handle a shift of having 10 people with an outbreak. So that's when we come in and assist logistically with the resources and staffing. When you have a 30 department basically contracting and or positive, that wipes your staff out, and you then go into having worked overtime and people work too many hours, and that's where the managers talked about the physical and well-being, mental physical well-being of the firefighters. They're concerned about their mental status and where they've been for the last week. So this is not uncommon, but it's with the different sizes of the fire departments, and Albemarle being one, you're basically wiped out a 30 department that were infected.
And just to be clear, your assistance is collaborating with other departments to provide additional staff.
That's correct. We have a statewide mission number, just like if it was a state of emergency under a hurricane or a large disaster. And if there were any federal funding or assistance with that, the responding agencies and or the agencies that's receiving it could receive funding for the epidemic. You know, we're late into the game and things have already been spent, but we're here as a state agency basically providing the state mutual aid assistance from outside departments. We've had departments calling from Cary, Johnston County. Of course, the chief has had South Carolina reach out, so it's overwhelming support. I believe at that time that the manager said only one question for each, and then the information is up front.
So, yeah, so let me thank you all, first of all, for being here. Few closing comments and bits of information. Again, to reiterate, we do have the information on the table, so please take a copy. A lot of information was provided today. It will probably provide additional information, but some of the basics of the things that we're able to share. Number two, moving forward, we will provide updates as they are necessary. In what form or fashion that will be, do not know right now. It depends on the situation will dictate what we do. Social media, Fire Department Facebook page, city Facebook page, other social media pages associated with the city is always a good way to get information out. If it takes something more significant, such as news releases or a situation such as this again, those are things that will be considered as well. Also, I know many of you have reached out to the city with questions, so you have our contact information, and we are trying to group responses so that everyone has the same information. That's the purpose of this event, so consistent information as much as we can share all at the same time to dispel any rumors or misinformation or head off any opportunity for that. So I want to thank everyone for being here and assist us in getting the information out to the public. Thanks to everyone in the fire department and across the city organization that has worked on this issue. Thank you to the citizens of Albemarle for your support and the surrounding community for your support. Please keep our friends and co-workers in your thoughts and prayers if you're so inclined as they face the challenges of COVID. Thank you all very much.